Hello and welcome to another episode of Glamour with Katrina. Well, today I'm very excited because I have Dr. Khalid here with us, who is a longevity expert and hormonal expert, along with my good friend Irina Bond from Medi-Gyn. So welcome to you both.
Thank you, Katrina.
Thank you.
So, Dr. Khalid, I'd like you to give us a little bit of background about who you are and what you do.
So I'm a medical doctor. My background in internal medicine and critical care physician, and American board certified in anti-aging, regenerative medicine, and functional medicine, and a leading expert in peptide therapy and hormone replacement therapy.
And Irina, can you remind our viewers of who you are?
Yes, I'm Irina Bond. I'm the owner of Medi-Gyn Center, the #1 hormone balancing center in Dubai. We are also a regenerative center in Dubai, and we offer our programs for ladies during their perimenopause and menopause stages, as well as reproductive stage.
Excellent. So, first question for you, Dr. Khalid. Please tell us how perimenopause and menopause is related to the aging process.
The aging process, actually the menopause and perimenopause actually is related to aging because there are certain physiological and hormonal changes which occurs at the midlife of the woman. And this happens due to hormonal changes, low estrogen, low progesterone, and this affects the hormones actually. And there'll be increase of cardiovascular issues, weight gain, sleep issues, mood swings, and other issues. And this all cause risk for chronic diseases.
Yeah, I mean, I went through it myself and I was fine. And I didn't go through menopause. It hit me at 55, which is quite late. And it was just like the switch had been flicked, and all of a sudden my body just went into shock, hot flushes and everything. So, I mean, what is the definition of these transitional stages of perimenopause and menopause? How can we make the transition smoother?
So perimenopause actually starts about 4 to 10 years before the menopause.
Okay.
And it can happen around 40 or younger. And it is defined by either if you have a period of two periods which are around 60 days in between. It could be a late sign of perimenopause. If you have around 7 days of prolonged period of cycle, then it could be also an early sign of perimenopause. The menopause is when you have the period stops at least for around 12 months, 12 consecutive months. Then you can label them as menopause. But at the same time, those who are in perimenopause, you cannot label them unless you rule out other causes which cause the same symptoms, like thyroid issues, gut issues, and other issues which mimics the symptoms of perimenopause.
Okay, great.
Dr. Khalid, I have a question. So perimenopause starts 40, a little bit earlier than 40, 35. Can we prevent any symptoms from happening actually way in advance if we take some measures?
Yeah, it's important that the foundation is important. If you have a good lifestyle, nutrition, physical movement, and all these can delay the perimenopause and even the menopause.
Yes.
And therefore, it's very important to focus on whether the nutrients are optimum, not the average. Supplements are required to reduce the chronic inflammation, which is part of the aging process,
Yes.
especially when you take sugar or lack of sleep or stress, all can cause premature aging. And this leads all to perimenopause very early and menopause very early. And those who have perimenopause around 40, the health span is quite low. They live less. Those who have 50 and above, then they live longer.
Yes.
Okay.
Oh, that's an interesting one. So, what would you suggest? What are the preventative measures? What should we do? Because education is plentiful now, even more than it was, I would say, 5 years ago. So, what is the first thing you think, the advice that you could give to a younger woman before she even starts perimenopause?
Well, I think it's very important that they have to have a leading and normal, healthy lifestyle. And this is very important. Physical movement, exercise, optimize your nutrition. Try to avoid as much as you can the inflammatory cause, any inflammation causing the body, like inflammatory food, vegetable oils, processed food, any gluten, At the same time, also to avoid any exposure to environmental toxins. We are already exposed to many toxins every day, especially from food. And so we have to be careful that these foods are exposed. So we have to know that how they wash their food, the fruits also, and how ensure that there is also avoid raw food, especially sushi and this, because this all can cause like parasites,
Yeah.
which can trigger autoimmune disease and aging process. So these are consistency in sleep. If you sleep, say 10:30 to 11:30 at night, which is good. Once you disrupt your circadian rhythm by say sleeping 2 hours later, then already you're causing inflammation in your arteries, and this affects the other issues in the body with aging, and also the sleep. Also, if you also delay the sleep late, also can cause the high cortisol and affects the body weight and chronic disease in the future.
Okay. I mean, is there any particular diet you would suggest that is better than another?
Not one size fits all. So everybody is different.
Yeah.
And I usually recommend them that as much as you can. If you have the ability to take organic, take organic. If you have the ability to take anti-inflammatory foods, it's very important. Avoid alcohol. I mean, there's no specific diet, but I just my three issues are always is just anti-inflammatory food. Avoid sugar, processed sugar. Avoid gluten as much as you can. Raw food and raw vegetables, which are all toxin.
Dr. Khalid, we have a notion, I've heard this notion of the way you look, it reflects how your organs are working. So the younger you look outside, the younger your organs inside, and the better working and functioning your organs are. Could you comment on that, please?
Yeah, so whenever something occurs outside the body, like the skin changes, especially it's common when we see acne or psoriasis or these issues, eczema, then it's more reflecting of what's going inside our body, which is mostly in the gut. And 80% of the disease is actually root causes comes from the gut. So it's very important to keep the gut healthy as you live and ensure that you always have a good checkup. But at the same time, before that, you have to have a good digestion, good bowel motion, and ensure that you're sweating, your drainage pathways for your body is always open. So gut, I always take it seriously, and I usually advise, it's part of the routine. Anybody wants to do a checkup, I just tell them just do a gut microbiome test to see where you are.
And gut microbiome is one of our main tests that we do for perimenopause and menopause as well, because that's when our gut is the most affected during this period, transitional period. Is that right?
What about water fasting and detoxifying the body? What do you say about that?
Well, this is a new trend actually. People fast for almost 3 days fasting. There's no absolute guidelines and evidence to support it too much. Some experts recommend to do it once a month of 3 days of fasting. Actually, when you do this fasting for 3 days, your immunity rebuilds again. And at the same time, even the gut lining in the gut microbiome actually change within 3 to 5 days. It's a good option. Once a month is okay, but it's left to everyone. But we don't recommend people who have chronic issues to go with, and it should be supervised by a physician also.
I mean, I've detoxed my whole life and I do water fasts, and I have to say I do feel the benefit from them.
Yeah.
I mean, it's a big thing now. A lot of doctors are recommending that because it lets the digestion rest, and with all the pollution and pesticides on food and everything, I think that makes sense to me.
So talking about fasting, apparently it improves or lowers our biological age. Can we touch upon that? How biological age is actually making us older or making us looking younger?
I don't get the question. It's an easier question.
Biological age. How does it matter for longevity? Does it affect our organs positively, and in what way? If your biological age in the body is lower.
So let me see. First, we have to define what's the chronological age and biological age. So chronological age is the date when you were born to the date today,
Yes.
and which is fixed. You cannot change this date. And the biological age is the body aging. Okay, so you can do several tests for that. You can do the true diagnostic age test, which defines your biological age. And at the same time, it gives you your age of your liver, your kidney, your lung, and your heart, and your brain, in fact. And if your biological age is younger than your chronological age, means your risk of chronic issues and disease are very less around 70%. But if you go more than chronological age, then the risk is be higher. The biological age has a big effect on the organs, okay? Because whenever you have chronic inflammation, it affects your body, so your aging will be very fast. If you have a lot of oxidative stress, also it can cause damage to the cells. So these are just markers which can give you a clue that biological age has an impact on the organs. And if the body is not healthy, then it affects the brain. And this also affects the quality of life in the later.
Well, that would be my next question. How can we prevent the brain aging? I mean, a lot of women in perimenopause and menopause, they have brain fog, they forget, they have, clouded head, and it actually happened to me. So what would you say is the thing that we can do to help the brain?
We can say that definitely with the lifestyle is very important. I would go first that they ensure that their gut is important. If somebody has a leaky gut, they will have definitely a leaky brain.
Can you explain to us what a leaky gut actually is?
So leaky gut is actually when the small intestine lining, usually the good food goes inside the body, but as the stress or unhealthy food or inconsistent sleep or antibiotics all can damage the gut lining. And in fact, this gut lining will be open, will have holes, and there will be, with these holes, even the bad toxins and food will go inside the body and cause damage. There is an immunity for it, but the immunity in our body has a certain limit to defend, but after that, it cannot manage. And this leaky gut can cause a lot of issues. It's a root cause of autoimmune disease, diabetes, hypertension, and other conditions. So back to the question regarding the leaky gut can cause a leaky brain, and this is one of the issues. The other issue is that you also recommend them to fix the gut and also to see the hormones. Estrogen declines in menopause, and this affects the risk of dementia very high. There are 6 receptors of estrogen in the brain. So estrogen, BHRT, is usually recommended not only for the brain, but also for the heart and the bones. So it's considered as a longevity, especially if you take the bioidentical, not the synthetic.
Okay, so then bioidentical versus synthetic. Can you explain the difference?
So synthetic hormones, which are fixed doses, which are usually given to by the conventional medicine, and it comes from animals' urine, more common actually, and it has a lot of side effects, and like blood clots, breast cancer, endometrial cancer in long term. And at the same time, the bioidentical actually comes from the yams, and it is less side effects, more natural. The structure is more consistent with the hormones inside the human body, and it can be in many forms, not only tablets. It can come in cream, gels, pellets, and it's more safer. And it should be prescribed by a physician who is known to know about the bioidentical. And usually, I don't recommend anyone to take bioidentical unless they do a test called the Dutch test, a urine test, because it's more reliable than the blood test. A single blood test. So the blood test, before they prescribe, they should do the Dutch urine test.
Oh, do you offer that, Irina?
Yes, we do offer that. We do offer all functional medicine tests we have in the clinic, Dutch Plus, the Dutch Complete, the urine test for neurotransmitters, gut, a GI map. This is a stool test. So all functional medicine tests we offer, including, of course, the serum blood. But of course, the Dutch test, as the doctor said, it's the most complete.
Now, I believe that your hormones go up and down throughout the month. So how often would you recommend someone on bioidentical to have a blood test or a urine test done?
So they do the Dutch test in the initial phase before prescription. And after they start the treatment, at least 3 months after the starting of the treatment, the bioidentical, they do the test after 3 months. So you can adjust the doses.
Okay. Good to know.
And with bioidentical, Dr. Khalid, we know for fact there have been a lot of studies done that they're very safe option for ladies to take during perimenopause, menopause, and that this type of hormones, they do not cause cancer in any way. Could you comment on that, please?
It's very unlikely to cause breast cancer and endometrial cancer. But at the same time, on prescription, you have to become. So if somebody, say, has a history of breast cancer and they want bioidentical, then it is a 50-50. There's no studies to support and no studies to... So it's based on the evaluation of the physician. But usually it's very unlikely to have breast cancer taking the bioidentical hormone replacement.
Thank you.
Peptide therapy. I know that's something that you offer. I mean, I know to do with the skin, peptides are very beneficial because of the molecular structure. They penetrate much deeper. And so how do you work with peptides?
So peptide therapy is actually blocking proteins, the building blocks of the body. And the peptide, just to give definition, so peptides are whenever the amino acid change. So if more than 50 is considered as peptide, as protein, less than 50 is called peptide. So how do I manage? First, we have to know it can cause, it stimulates the growth hormone and enhance the signals between the cells and tissues. And also it increases the blood vessels inside the body. It heals the injuries. It heals the leaky gut also. Improve your immunity. It reverses the immunosuppression. And it has a lot of benefits. Even for the body, or for the brain, it has a role in reducing the inflammation and treating the cognitive decline. So when it comes to perimenopause and menopause, we use it actually to balance the hormones. So it has a role in balancing the hormones, and it's good for the energy. It reduces the fat and increase muscle mass.
Oh, wow.
And improve the cognition. And it has a multiple, and depends on the peptide, there's 70,000, but there are certain top 10 common, we should use it commonly for people for anti-aging and
how do you administer it? Is it injected?
Yeah.
Is it oral?
Yeah, so the forms for the peptide therapy are more commonly injections, okay, and it can be taken as in the abdominal fat, and it depends on the protocol. Some peptide can be taken 5 days in 1 week and 2 days off, and then on an 8-week basis or 3 weeks, and after that they can stop, have a break, so the body can adapt to heal, and then after that they take another cycle. So this is how we do it. It's quite easy.
Expensive?
It should be expensive.
Well, it's if health is expensive, what is gonna be
I know that all my
illness like?
viewers will be thinking, how much is this going to cost me? Can you give us a price range?
No, I'm a physician. I'm not.
I'm not a
Good
business.
answer. Good answer. So if I was to come to you, I've been on Bioidentical for 3 or 4 years now. What would you do with me? What would be the protocol with someone that's already been taking Bioidentical?
If you don't have any symptoms with the bioidentical, I will ask you first whether you did the Dutch test or not. If you have symptoms, you have to do the Dutch test. If you don't have symptoms, just continue on. If you have other symptoms, then whether you go to the next phase, which is the anti-aging, which is the peptide therapy, which has a role in the anti-aging process, since you're already stable on the hormones. So you may take certain peptides which increase your telomeres, the prolongation telomeres. And you can take certain peptides to improve the, what we call this, the overall well-being. So your gut issue, your brain, your focus, your energy, which is very common that women come to me just for these issues, which is they need energy, reducing
I
the
think
weight.
the energy and the brain is the two things.
Yeah. And it's very common, and take it for that.
What would be your 3 top peptides? If you had to only choose 3 out of the 10, what would they be?
I will use for CJC 1295 / imoprolin.
And what is that?
That's a peptide.
Okay, but what does it work on?
So it works on stimulating the growth hormone, release of the growth hormone.
Amazing.
So it has a good way in reducing the fat, builds the muscles, increase sexual drive, a repair of the nerves, reduce the inflammation, and increase the body mass, muscle mass. And this is more common than those who are people who have busy work. They don't have time to go for regular exercise in gym, so they can use this. Yeah.
Okay. Next one.
Next one is apitalone. Apitalone is a peptide which prolongs the telomeres of your the aging. So it's an anti-aging effect. Plus, it has a control on the pineal gland. So all the system is control.
Amazing, yeah.
So it controls that. So this has been taken only, I think, once a week, actually, apitalone for 10 weeks, and then you repeat another year.
Third one?
Third one, okay. Third one, I will go for, like for your case, I will go for MOTSI. MOTSI is one of the peptides which stimulates energy at the level of the mitochondria.
Oh, wow.
Yes, because as we age, our mitochondria gets less. And so this will stimulate the mitochondria very efficiently. So you have a big boost of energy every time.
Amazing. I think we're living in a very exciting day and age where there's so much available to us now. And, you know, the older woman is no longer like our mothers were. And I think we can age very well and very gracefully and, you know, in optimum health, which is fantastic to know.
Absolutely. I agree. I've just had my dose of peptides.
Oh, you have? That's why you're glowing. You're glowing.
Yes, the first one that Dr. Khalid suggested. And I have to say that the energy levels, libido levels, and also that drive, it's kind of really pronounced with the peptide therapy, with that one, which I've been taking for now 2 months or so.
Amazing.
Yes.
I mean, I think for me, it is that my drive has gone. And I think it's because of the lack of energy. And also, a lot of women complain about the sex drive through perimenopause and menopause. What can we do about that for them to recover as fast as possible? And the dryness that they feel, the uncomfortable feelings during sexual intercourse and that kind of thing.
Yeah. So a peptide has a role in this. So the common peptide we use could be PT141 and another one called kispeptin. And these all the CJC129. These are the 3 peptides which can be used. You don't use all together. You can try use one and see how you affect, because everybody have a different response.
And how long does it take to actually feel the difference within your body, or is that just an individual thing?
So 2 of these peptides should be taken during. It's okay, I can talk.
Yes. You're a doctor. You can say whatever you like.
No. Yeah, okay. So one peptide is usually taken actually by nasal or injection, and usually taken at least 2 to 6 hours before the intercourse during that time. So it has a time frame of 6 hours to take that and see the effect, and it can be taken at least 2 to 3 times a day if required. The other peptides are taken in a different way. They're taken on once a day and see how they affect by injection.
And what could I expect from taking them? What would be the effects for
So
me?
it increases libido.
Okay.
Yes.
In women, do men suffer from that?
Libido? Yeah, we have men who have issues with libido.
Testosterone usually is related
testosterone,
to.
yeah.
Right?
There are other factors, but testosterone is one, yes.
So, Dr. Khalid, we know that you are a functional medicine guru. So tell us a little bit about how functional medicine actually digs deeper to the root cause of the condition and treats that condition rather than the symptoms of the condition.
Yeah, so the functional medicine actually digs into the history of the client, and from the date of when he was born, and during while he was in the fetus, how well was the being of the fetus, and the mother was healthy during that time. Was it delivered by a cesarean section or normal delivery? Breastfeeding for the first 2 years, we always ask. Any issues in the history of childhood and during the youth? And because all these factors has a risk of changing the microbiome during the lifetime. Okay, and also we dig the history of the gut issues, how's their healthy lifestyle, nutrition, type of food. Also go to the other issues like hormonal imbalance. So we go to a very holistic approach. And that holistic approach is very important because in conventional medicine, they only focus on symptoms and organs. So they don't connect. We try to connect every part of their life and their organs together because in overall it's the same as the aging process causing. So based on that, we customize and provide a diagnosis. And sometimes, most of the time, they need more additional functional medicine lab tests like the gut microbiome, organic acid test, urine for neurotransmitters, depending on every patient. Based on that, we can define more on what's the diagnosis.
So once you start on these products, bioidentical hormones, peptides, is it something that you have to keep taking for the rest of your life?
Yeah, so bioidentical hormone replacement, if the person is already satisfied with and controlling autism, they can take it all their life. If the peptides, usually the recommendation is to do on a protocol basis. So if it's injection, they can take it only for 2 months for 3 cycles, where there's a 1 month break each cycle. And then they can repeat after that for 6 months, another 6 months. The protocol I use usually for the 3 cycles, I try to use during the 3 cycles 6 different peptides. So the person will get the benefit of all the benefits of all different peptides they can do, which heals the body and optimize the health and also for longevity.
So is that something that is ongoing, or you would only do it if you're feeling unwell or, lacking in something or another?
No, well, peptides usually doesn't need that the person is to be have symptoms.
Okay.
I have people just coming just to have peptide for longevity.
Okay.
So we switch them to longevity protocols.
Any side effects?
Very, very unlikely.
That is amazing.
Yeah.
Functional medicine and aging, how it is connected and how it is important to incorporate functional medicine approach for longevity.
Yeah, so the anti-aging medicine, our approach is functional medicine, but the anti-aging will go later to detect, to diagnose, prevent, and treat. That's how we approach. So the approach is functional medicine approach, but the management is totally an anti-aging and regenerative medicine approach. You have to ask about peptide bioregulators.
Oh, yes. Peptide bioregulators. Can you tell us about these?
Oh, sorry. Peptide bioregulators. Okay, so peptide bioregulators are different from peptide therapy. So peptide bioregulators actually are amino acids which are around 2 to 5 or 2 to 4 amino, very short chain of amino, very small. So the unique about it, it penetrates inside the cell to the DNA. And when it goes to DNA, it switches the epigenetic expression and causes rejuvenation of the cells. So it can turn the cell back, homeostasis back to normal. So if I have someone who has hypothyroidism, it can go back to normal. The unique about the peptide bioregulators is capsules, no injections. It can be used it's specific for the organs. So if you give it, say for the liver, it goes to the liver only. It goes, no, and there's very safety, no side effects. It goes for the ovary, but it can be used for people who has ovarian dysfunction also, and it restore the balance of the organ.
Now, I was told that I had dangerously high cholesterol, and I went on a protocol to fix it, but I was told it wasn't really high due to the parameters, but I did have a fatty liver. Now, I believe that that's something you've got to watch continually, because for me, it is genetic. My mother and father had high cholesterol. So what would you suggest for that? What would be the best thing that I could do?
The first, ensure that you have support your liver and bile flow by good nutritious like beetroots, radish, coriander, curcumin. These can support the liver from proper detoxification. Number 2 is to ensure that you have take the supplements also to regenerate the liver cells and cause better detoxification, like milk thistle or NAC. So this should be also recommended. At the same time, not every genetic person who has a gene has a disease. So just to give you an example, so if the person say has say the parents has one of the parents had fatty liver, so the next generation there's a chance that 25% they will carry the gene which has a chance to have fatty liver. So the fatty liver will not come up unless there's 90% there is disruption in the lifestyle which causes this flare up of the gene expression. So it's very important that modifying your lifestyle, the gene expression can be reversed back and the disease can just go to remission.
I mean, I have to say, when I found that out, I was very upset because I've always taken great care of myself. I don't smoke, I don't really drink, I eat well. And it was a bit frustrating, but we did manage to get it back to normal. But I feel that I always have to keep on top of that now.
Absolutely, yeah. One of the good also supplements is berberine, which can also
Yes,
reduce.
I take that.
Yeah, so these are the recommended.
I take a lot of supplements.
How many?
So many. I had them all lined up this morning and I'm thinking, this cannot be good for my liver. You know, you have to, sometimes you just don't know what to do, you know. You take so many supplements and you think, well, the gelatin capsules that they're in, that has to be processed through the liver as well, you know. So would you recommend that you should take a break from supplements? There's a question.
Yeah, it's better to take a break.
How long?
Well, I recommend you usually take at least 1 to 2 months break.
Oh, that long?
Yeah. And
Really?
it's very important to ensure that not every supplement is safe.
Yeah.
And not every brand is good.
How do we know, though? Can you give us any indication as to how to measure that? Because there's so many brands on the market. And one person says this one's good, the next person says that one's good. iHerb is selling all different. Yeah.
Can I answer that?
You're the nutritionist, Irina.
A consultation with Dr. Khalid Shukri.
Yeah?
Yeah, they can see me. I will ask that question.
So you know what brands are good and what brands are bad. So we have to have a consultation with you to find that out.
Sure.
Great.
We know for fact our ladies come to us and they take a lot of different supplements, right, left and center. And sometimes far too many for what they need and sometimes completely irrelevant for what they need. But the key is to actually do have a consultation with the specialist and make sure that you are taking the right ones and make sure that you prioritize at certain period you take one set of supplements, then the second supplement, set of supplements, so on and so forth, because I think that could do more harm than good.
Prescribe that? Is it through a urine test, through a blood test? How would you know what supplements I need to take? Or not, as the case may be.
What supplements? Okay, yeah. So what I do in the clinic, I do an oligo scan.
Okay.
And this scan will give you your minerals and your heavy metals and your vitamins. This is one test which is non-invasive. It takes only 10 seconds. And it detects the level of this minerals and vitamins at the level inside the red blood cell by spectrophotometer technology. Now, the second test, which is a urine test, and it's called metabolomics. It's more advanced test, or NutraValve. So what it does, it gives you it's a more detail at the level of the body. So it gives you like this. So you say it gives you that your level of vitamin B12 is low. It tells you also what is the dose you require. So instead of giving you blindly the dose from the supplement, you will know what's the correct dose for your body.
And I think that's very valuable because we don't know.
Yes.
And we never know who to ask, who to go to for that kind of information. So that's very exciting. I must come and see you.
Absolutely. And we invite everybody else to come and see Dr. Khalid Shukri.
Yeah. Where are you, Dr. Khalid?
Currently, I'm in Wealth Clinic,
Wealth Clinic. And where in the city is that located?
Jumeirah too.
Jumeirah too. Ah, very central. You know, if you were to give us any advice, how can we stay young and healthy throughout our lives? How is longevity going to play a part for us on a daily basis? What could the average person do to help themselves? Apart from diet, exercise, we know all of that.
Yeah.
What would be your top 3 things?
Top 3 things. Okay, good. Peptide, biohacking modalities like cryo or cold plunges, infrared.
Okay, stop. Cold plunges. I had not Dr. Benoit, who does the ice baths in Dubai. I had him on a podcast and I tried it myself for the first time. And I have to say, yes, I did feel energized after it. And I was not looking forward to doing it. I'm very sensitive to very hot or very cold temperature. But I did it, and what got you through it is definitely the breathing. So how often would you suggest people do ice baths or cryotherapy?
Well, ice bath, cold plunges, if they can do it every day, it's fine. But
Wow.
average is twice a week, you'll be absolutely good.
Okay.
Yeah.
And how does that help you on a scale of 1 to 10?
So it helps you a lot. It's 10 because you cause stress on the body. And when you cause stress, you create new cells in the body, generate more cells in the body, and better energy, immunity, better recovery.
Okay, great. And then, sorry to interrupt, the next thing was, you had top 3 things.
Yeah, peptide bioregulators. And the reason why, just to give you, if you see the age of every person, the average age is around the world is around 70 to 80 when they pass. And people live up to 120. Very small number live up to 120. And if you calculate that 40 years gap between 80 to 120 is around 40 years.
It's a long
which
time.
is around 30%, correct? Every cell in the human body has a biological reserve of 30%.
What does that mean? What does that mean?
It's a biological reserve that if you don't use it properly, the aging will be quite at around 80, 70, 80. So by triggering the biological reserve by the peptide bioregulator can enhance more, restore your homeostasis much better, and longevity will be much better. In addition with the biohacking and the other lifestyle modification, because you have to have a good foundation also.
Great. How important is good water to drink?
It's important. It's, when it comes to water, there are two different types. The water we drink and the water where we wash or shower or swim, these are water. So the type of water, what we drink is very important. It has to be clear of heavy metals. It should be alkali, preferably, or hydrogenated water.
Hydrogenated. I've got one of these bottles that does that.
Yes, it has anti-inflammatory, it's antioxidant, it's anti-cancer. And then now we go to the next part, is the water which people forget, is the shower water where we wash ourselves. And this is very important because most of the pipes in houses everywhere, it can become rusty, and so there's a risk of bacteria, molds, and heavy metals. So to clear it up is very difficult. So the recommendation is to use, previously was a filter.
I have a water filter.
So water doesn't clear the heavy metals 100%. So you can use the new technology of the frequency, water frequency, where the water frequency can oxidize all the heavy metals, clears the bacteria and the pipes in a very short period, around 48 hours, to small apartments up to big houses for 1 week. So it clears everything. You can use that water very clearly.
What is water frequency? I mean, explain.
So the water frequency, there's a device which sends frequencies.
Oh, it's a device. Do you install it into your home, into the plumbing of the water?
No, the new one, which is called Aquavita, It doesn't, there's no installment. It's like if you have a pipe, so install outside the pipe. You hang it on. It's a small device.
Okay.
It's the palm of the hand.
Okay.
And it hangs outside the device. It sends around 40,000 frequencies.
Oh, wow.
And it goes straight up to,
Biohacking stuff.
up to 150 meters straight, 150 meters back, the frequencies, and change the structure of water. In addition, it oxidizes all the bad materials or bad issues there.
And where can we find that?
It's in Germany, but they have now I think, in Dubai.
So you can buy it in Dubai.
Yep.
Aquavita, it's called.
Aquavita.
I think I've heard of that actually, now that you say it.
Yeah.
Irina, any closing questions?
Well, we believe at Medi-Gyn, and I'm sure Dr. Khalid perhaps agree as well, that the future of medicine is frequency, as Albert Einstein says. So perhaps we will finish on that point, and we could touch upon that in our next podcast.
Amazing. Dr. Khalid, any closing words of wisdom from you to our viewers?
Well,
Because I think every woman wants to stay young and beautiful and healthy. You know, we want to age with the vitality that we had when we were younger. So what advice would you give us?
there are many advice, but I give just only few.
Okay.
Okay, so you eat less, live longer. You build muscles, you live longer. You sleep more, you live longer. And just be happy always and enjoy your life. Be joyful with your family and target your goal for a healthy lifespan.
Amazing. Thank you so much. That was wonderful. Well, I hope you enjoyed this episode with Dr. Khalid and Irina, and there were some very valuable tips. So until next time, stay healthy, stay beautiful, and be good.